Okay, everybody, it's a couple minutes past the hour, so I'm going to get started. So I'm Martin Smithson. I'm the Channel Solutions Manager for Canada, and our sales team asked me to host this one today. I will move this out of the way so we can all see what I'm talking about today. So thank you for joining. Today we're going to show you some stuff about PaperCut in a healthcare environment. So I've gotten, anytime that I present something, I like to go out there and try and find some new information, as well as possibly some stuff that you guys already knew if you've got experience with PaperCut. And for those of you who haven't had any experience with PaperCut, hopefully we're going to show you some new things. So I'm going to slowly launch into this. And we're going to talk a little bit about the healthcare environment as a whole. So the healthcare environment in the U.S. is almost a $20 trillion industry. In 2019, 35 million healthcare records were exposed. And we're going to dive a little bit further into the ramifications around things like that. There in the U.S., there's over 6,000 registered hospitals. 17% of the gross domestic product actually goes into healthcare, which is a significant amount. There's also almost 250,000 physician offices in the U.S., and the healthcare spending worldwide is around $114 billion. So it's a pretty significant market. The reason people put slides like this into a presentation is just to show you how much money is being spent in these certain industries. So you know how much is kind of out there. PaperCut has sold close to 500,000 user licenses into healthcare or health-related organizations. The healthcare landscape in the U.S. Is forecast to reach about $400 billion by 2024. Spending on software solutions in the healthcare industry is going to continue to grow. And it's the fastest growing sector of the U.S. economy, employing about 16 million workers. Providers project their IT budgets to increase this year with privacy, security, compliance, and process improvements as high and medium priorities within their organizations. So for the first time on these, we're actually including some Canada stuff because I'm from Canada, and I like to make these somewhat all-inclusive. So in 2019, the total health expenditure was actually $264 billion, or $7,000 per person. And it's anticipated that it will be representing about 11.6% of our gross domestic product. Healthcare in Canada employs about 2 million people, which, and I love stats like this, based upon a population of Canada being, around 32, 33 million is, somewhere around 1 in 16 people are working in healthcare in Canada, which is a pretty significant amount. We're going to talk about some small opportunities. These are typically, and I don't want you to think that, hey, all of this we're talking about today is just for those massive hospitals. And, I'm not the enterprise, sales rep for my team. There's also opportunities out there in, organizations that typically have like 1 or 2 facilities. They need to have some tracking. They need to have some mobility printing. And absolutely, they need to have the secure print release. We're also going to talk about those medium to large opportunities. So these are hospitals with multiple locations, clinics, doctors that are moving around between these offices. Typically, they want to go and do things like bill back to different departments for charging purposes or reconciliation of billing at the end of the month. They also need the mobility printing. They often have some EMR, medical record integration, as well as some rules-based routing and maybe some load balancing in their organization. Typically, the pain points in the healthcare vertical are cost savings, accountability, security, and accessibility. And we're going to talk about each of these in depth and the features in PaperCut that go to address these pain points within an organization. So first, we're going to talk a little bit about cost savings. And we're going to talk about those medical records. So e-health records or e-medical records print tracking. So there's a couple of things that come into play here, and the 2 biggest players in the market I'm going to talk a little bit about going forward. So we're going to talk a little bit about Epic. PaperCut is soon to release. They've been working since July 2019 with Epic. They have something, you know, they call their development program App Orchard. So PaperCut's been working with them since July of last year. They're going to be releasing something very soon. So we're in Q1 already of 2020. So something is going to be coming out from PaperCut that is going to support a tighter integration with Epic. And we're going to be able to produce some pricing and SKUs. Unfortunately, I don't have anything more for you at this time as far as, you know, nitty gritty, like what's the exact price of this going to be, how is it exactly going to work. But it is something that PaperCut is working towards and will be released very shortly. Those of you who've been working, you know, with ACDI and PaperCut over the years know usually PaperCut will have a couple of releases during the year, or 4 releases during the year, and those usually coincide with the quarters of the year. So we're going to probably be expecting a 2020 release very shortly. So PaperCut 20. So the way that Epic works is at the very core of an Epic system is the Epic print service. So when a user generates a print job, it's sent to the Epic service, and it's converted to either a PDF document, an XPS document, or a text file, and then that document is sent to the Windows print queue hosted on the EPS server. There are 2 versions of Epic. There's Epic systems prior to 2018 and Epic systems post-2018. So for those systems that were prior to 2018, if the customer is managing an older version of Epic, then the hosting and managing their Epic service is usually done on site, and PaperCut can be installed with the EPS and track user name and therefore the information. So we can trace it back. We can allow all those things in PaperCut that are you know, very much based upon the user, like the Find Me printing, the secure printing, and things like that. Epic systems that were created 2018 and beyond. PaperCut is working on something, a web-based service, but it's under development currently, and but it will be out at some point, and it's going to allow you know, the same amount of traceability. We're going to talk a little bit about Cerner as well. So Cerner is another big player in the medical industry. Cerner doesn't allow a lot of partnerships, you know, with other products. So you know, there's not a lot of people out there that have a Cerner approved solution. That doesn't mean that we can't work with it. At PaperCut and ACDI, we've got experience working with Cerner, so we're able to successfully draw the information out of Cerner systems and provide some of the things, you know, as far as like the Find Me printing and tracking versus names. Some other things that are important for hospitals are shared accounts. So in many organizations, such as hospitals, they'll want to go and charge things out to different departments within that hospital or medical facility. So through PaperCut, we can do that through the shared account list. So they can charge things out to different departments, different products, or projects, sorry, phases, or different subject matters. In accountability, PaperCut's got a really nice online dashboard. The PaperCut online dashboard means that we're not tied to one platform or another platform. PaperCut will run on Windows, it'll run on Mac, it'll run on Linux, and it'll run on Novell. PaperCut offers 80 standard reports. The report that we have up on the screen right now is the executive summary report. This is a report that I like to, when I put PaperCut in on a 40-day trial, I like to ask the customer if after 2 weeks or 30 days, I can pull this executive summary report. And this executive summary report will give me enough high-level information that I can start building an ROI case of the customer. Some examples of some other reports that we can have in PaperCut are unreleased print jobs. These are the jobs in a pre-PaperCut environment that would be evidenced by sitting on the exit tray of the device at the end of the day, or maybe sitting in the blue bin that's beside the device. We can also get information like user printing summary, or maybe the printer usage summary, so we can tell who's printing and where they're printing those documents to. So if we want to make recommendations on their fleet going forward, we can know what devices are being underutilized or overutilized, and we can also see what users are printing the most. PaperCut's got over 80 standard reports, as well as with the new feature of creating custom reports. There's a number of different ways that you can pull the information out of PaperCut. We can also do things like rule-based routing. So we can do things to further drive down some costs in an organization. Like maybe we're going to implement a rule that every job that's printed in color gets, converted to black and white. Maybe we're going to reroute jobs from small single-function desktop printers to larger devices where the cost per copy is lower. Or maybe we're going to do things like we're going to convert jobs from being single-sided to double-sided. These are a number of different ways that we can implement rules, and those rules can drive down further costs in an organization. We also have something that's called print archiving. What print archiving does is it stores a copy of the printed document. So if an admin needs to see what people were printing, the things can be, reviewed and we can tell exactly what people have been printing or not printing. There's other practical applications for this. You can actually go and you could put these documents into a folder, and you could actually use a third-party piece of software like a capture solution to OCR these documents, and then maybe do some extraction on the documents. So you could do flags and say, if somebody's printing something that's got somebody's medical number on it, that it can alert somebody. So there's different applications. Don't think of print archiving as just a way of viewing things that people have already printed. There's other practical applications for it. I'm going to talk a little bit about the security now. Security is very big in hospitals. One of the things first and foremost that we can do is we can do something called secure print release. So a user goes and prints their document, and it's held at the device. They walk up to the document and they badge in using, maybe their username and password, maybe the card like we're showing in the graphic here. We even have a fingerprint reader, and coming soon we're going to start having, although it's already started to filter out there, is we're starting to see some Bluetooth, so some cell phone technology being used as an authentication. One of the reasons that the authentication is so important is the health HIPAA is a law designed to establish privacy standards for health plans, doctors, hospitals. It's basically set out there to protect the patient's information and their medical records. So we also have in Canada, we have something very similar. It's called the PIPEDA, and it's the same basic idea. It's out there to protect the patient's information from being leaked out. Things that need to be protected by both of these in common. You need to protect the names, the phone numbers, social security numbers or social insurance numbers in Canada, email addresses, account numbers, IP addresses, and web URLs. These are all things that have to be protected. Some HIPAA enforcement actions. So, for example, a 12-physician pediatric and dermatology practice paid $150,000 for HIPAA violations. A 5-physician cardiology group paid $100,000 as a result of failure to comply over multiple years. An orthopedic clinic was charged $750,000 after turning over close to $20,000 patient records to a potential business partner. And probably the biggest and the most sobering one out there is the Advocate Health System in Downers Grove, Illinois, reached a $5.55 million settlement in 2016 related to 3 breaches in 2013 that compromised the protected health information of over 4 million individuals. So that was the largest HIPAA settlement to date. So this is a big deal for medical. As far as the security goes, PaperCut offers end-to-end encryption, so any of the data that's being passed around is encrypted, as well as we can encrypt some of the print stuff through the Windows encryption. Find Me Print is very similar to the secure print, but how this works is a user prints their document to the server. It's held on the server, and regardless of what device they walk up to, they can authenticate and they can release their device so long as it participates in the Find Me Print queue. We also offer full-page watermarking, print archiving that I discussed already, and PaperCut is private cloud ready. For accessibility, we offer mobility print. So a lot of people see mobility print, and we've got a doctor up there on the screen working on a tablet But the reality is the mobility print is being largely used the most for bring your own device laptops. So anywhere that people want to print a document and they have a device that's not authenticated to the network, such as a bring your own device laptop, a smartphone, a tablet, we can facilitate those requests. PaperCut offers integrated scanning. So we allow users to go and scan their documents. Because the user's got an authenticated device, we now know who that user is. There's no reason why that user should have to go and type their email address in if they want to go and scan something to themselves. We know who they are. We're just going to provide them with a button that says scan to my email, which is where 90% of users scan things to. We can also, based upon their credentials, we can allow them to scan to a folder. So maybe they work for the cardiology department. We can set it up so anybody who belongs to the cardiology department can scan to a cardiology folder. We can also allow users to scan to cloud storage repositories, such as Box, Dropbox, Google Docs, Microsoft OneDrive, OneDrive for Business, pCloud, and Evernote. And I'm probably forgetting somebody there, and we're adding them all the time, but we can allow users to scan to cloud storage. We're also allowing for account selection at the MFD. In some cases, if a user is printing from an unauthenticated source, like they're printing from their bring their own device laptop or a smartphone or tablet, we don't necessarily know who is printing, or if they wanted to, we know who is printing, sorry, but we don't necessarily know what department they wanted to charge it out to. So what we can do is at the MFP now, we can enforce a user, if they have to assign an account to anything that they printed, before they can release the print job, when they walk up to the device, they can go and enter an account code. PaperCut has also added, in recent years, we've done a lot of work on OCR scanning. So documents can be converted from a pretty picture with words on it to something that is searchable, so like a searchable PDF, or something that's editable, like a Microsoft Word file. So we can go and convert things into something that's more usable than a PDF file that just has a picture of the word on it. PaperCut also offers site servers. So this offers a little bit of resiliency for organizations that have multiple sites. So if the WAN goes down, so the wide area network connection goes down between sites, is users in a remote site can still print based upon there being a site server there and some of the information being cached on that site server, such as the authentication information. They could walk up to their Find Me Print device and they could still authenticate using their medical card or their identification card and release their print job. PaperCut does work on all platforms. I mentioned this before. We're not tied to any single one platform. We're one of the few softwares out there that will run on Mac, it will run on Windows, it will run on Linux or Novell. PaperCut can be installed on a server, or we do have print serverless environments as well. And PaperCut is cloud ready, meaning if your customer has a private cloud, that they can install it in the cloud. And please pay attention to PaperCut's website, because PaperCut MF, right now they're starting to advertise PaperCut Pocket, which is PaperCut NG in the cloud, and soon there'll be information coming out about PaperCut MF in the cloud. Some competitive comparisons. So this is just some short notes between some of the other products that are out there in the market. Some of our competitors have a cumbersome installation. Some of them have multiple or very limited administrative dashboards. Sometimes you need a dedicated staff member to set it up and monitor it. A lot of systems require external hardware terminals to be added to devices in order to do the authentication or even the job release. Some of our competitors' solutions only support certain MFB brands or platforms, so they'll only support one brand. A lot of them will have long ROI cycles or expensive features, and sometimes they offer poor support. These are not things that you can count on from PaperCut. All of those things are not an issue with PaperCut. So some customer health stories or case studies here is in the healthcare market. So some of these, like for example, Metro Health had a cost reduction and about 50% reduction in paper So they were printing before PaperCut 54 million pages per year. So it was a huge, huge cost savings to their organization. And I was on the interview when we were interviewing Metro Health, and oh my gosh, like some of these, it's almost like they make you blush because they just love the product so much. And that's one of the ones where we were talking to the customer. And I'm not on a lot of these, case study interviews, but that customer just loved the product so much that, it was making me blush a little bit over the phone. Another one that we have is Burnside Hospital. So a little bit of a summary here. We're looking at healthcare in 2019, spent about $19.1 trillion. That's probably going to be around the same, or based upon the statistics, go up a little bit for 2020. So you can count on there being a lot of opportunity in the healthcare market. PaperCut is the preferred cost recovery solution for healthcare institutions. It has a robust EHR, EMR print tracking, the online dashboard, secure print release, and a lot of other features that make it the easiest, most comprehensive way to manage print costs while fulfilling the requirements of a HIPAA certification. So where do we go from here? I've got a couple of questions, and you can ask your sales rep for these. So we've got kind of the battle card questions, so some questions you can ask your healthcare customer. So they have any budgetary constraints or cutbacks that are affecting their organization. How are you currently monitoring staff printing and copying? One of my colleagues told me this one, and I really love it, is most customers' print environments is like an open bar at a wedding. There's just zero accountability. You've got no idea, who drank the most, if they were drinking the premium or the cheap stuff. At the end of the month, or at the end of the night, whoever has to pay that bar tab just pays the bar tab for the most part. And it's the same with their print environment. At the end of the month, they get a bill for their CPCs, but they've got no idea, who was printing, what those people were printing, why they were printing them. These are all things that we can find out with PaperCut. So, how much revenue is not being captured by lack of control to charge back to departments? How much waste is being generated by having no control? How many, things are people printing that they didn't really need? If, they want to charge things out to departments, how are they doing that? How are things could be done if budget was freed up for them? Could they buy that new, cardiology machine if they could get rid of, some of their wastage in their environment? How are they tracking the prints on their desktop printers? Some organizations have ways that they're tracking print on their larger devices, but they don't have a way to track it on their desktop printers. How are you reconciling the copy scans, print faxes for budgetary reasons? Are you able to track that kind of stuff? Faxes coming in sometimes, get totally lost in the shuffle. Does your hospital have any sustainability environmental initiatives? This is something that's becoming very, prevalent in today's society. And how are you accomplishing paper and energy reductions? Can you be more environmentally friendly? So these are all things. Are there any ways that we can improve your process? What is your dream scenario?
If you had attended live, you could have tried answering our trivia question and joined our Q&A session. Thanks for watching. We'll see you at the next ACDI sales webinar.